The arc of the moral universe is long, but it bends towards justice. Martin Luther King Jr. In this month of February, where we celebrate Black History Month, we talk about the stories of triumph and justice and moving towards a more just society. I think some stories that are important for you to know are the stories of the start of the Community Health Center movement and the story of our very own startup with our founder, Cornell Scott. In 1964, a group of students from the North went to Mississippi to help register Black Mississippians to vote. Very dangerous work, and they were at risk for serious injury. And to help support those activists, a group of doctors went down as well. They named themselves the Medical Committee on Human Rights, and they helped provide support not only for the activists, but for the population that went without care. At the end of that summer, they all came together and asked the question, how do we sustain this? How do we make this work over the long term? They decided that they would take up the cause of beginning community health centers in this country. And with that, Jack Geiger and Count Gibson went to Washington and secured the funding and the commitment to start the very first community health centers. It was in 1969 when our very own health center was started by Cornell Scott. Cornell Scott came from Arkansas to New Haven to get a degree at Yale University. When he saw the conditions in New Haven that were so challenging, he said, let me do what I can do. Knocked on doors, sat around kitchen tables, and really organized this community. And with the Yale School of Public Health, helped to start our very own health center right here on the Hill. It's a pleasure to be a part of this legacy and to know that the work that we do and the work that he did ties back to so many others who have struggled, and that we are part of this long moral arc that bends towards justice.
So the Black Panthers opened up the doors for many people, many families, to have quality health care. We came a long way from storefronts or hastily built shacks to now. Now we have access to the internet. We have access that we can help families come right into our office, and we can get them directly signed up for Medicaid, Access Health CT, SNAP, and our own income-based program, the sliding fee scale.
They connect people with health care, with services they needed, as getting a physical, getting tested, getting blood work, and it draws me because we still doing it at this time.
For Black History Month, I want to pay homage to Miss Mamie Phipps Clark. She's the first African American to earn a PhD in psychology, best known for her work with the black-white dial test. Because of her work, Miss Clark has laid the groundwork for a person like me of African American descent to be able to practice here at the Cornell Scott Hill Health Center, to work many children in the community that I serve. It's very important that the groundwork that she laid before us to give us an opportunity to deal with serious issues such as mental health. I'm inspired by the work that I do because I know I was a young person who needed services, but it was unavailable to me because of all the stigmas that surrounds mental health. Doing the work that Ms. Phipps Clark has pioneered has helped a person like me understand mental health a whole lot more, and it helps me so that I can serve the children here in this community much better.
When I think about pioneers in the health field, I think about Dr. Crumpler, who was the first African American woman to earn her medical degree in 1864. She devoted her life to improving health care in the Black community through research and working in clinics. The providers here at Cornell Scott Hill Health Center continue to follow that path by offering state-of-the-art care to all of our patients.
So even though we face the difficulties of today and tomorrow, I still have a dream.